Health promotion is a simple yet powerful idea. It means helping people take control of their own well-being. Think of it as building a strong house. You want to use the best materials and techniques so it can withstand any storm. For nurses, especially family nurse practitioners, this is a central part of their job. They don't just treat you when you are sick. They work with you to create a lifestyle that keeps you healthy in the first place. This involves talking about good nutrition, the importance of exercise, and managing stress. It's about being a partner in health, guiding you toward choices that build a stronger, more resilient you day after day. Disease prevention is the other side of this important coin. If health promotion is about building that strong house, disease prevention is about actively looking for and fixing small problems before they become big ones. It's like checking the roof for leaks after a storm, or making sure the foundation is solid. For a family nurse practitioner, this means using proven tools and strategies to stop illness before it ever starts. This includes things like giving vaccinations to prevent infections like the flu or measles. It also means conducting regular health screenings to catch conditions like high blood pressure or diabetes early, when they are much easier to manage and treat successfully. These two concepts, health promotion and disease prevention, work hand in hand. You cannot truly have one without the other. Imagine a patient who wants to quit smoking. The nurse provides resources and support, which is health promotion. At the same time, the nurse might screen for lung cancer or high blood pressure, which are risks associated with smoking. This is disease prevention. It is a complete approach to care. By focusing on both, nurses help people not only live longer lives, but also enjoy a better quality of life. They empower individuals to become active participants in their own health journey, making informed decisions that lead to lasting wellness. This proactive approach is what modern healthcare is all about. It shifts the focus from simply reacting to sickness to proactively creating and maintaining health. An FNP might help a young family develop healthy eating habits that will benefit their children for a lifetime. They might work with an older adult to create a safe exercise plan to maintain strength and prevent falls. These are not small things. They are the fundamental building blocks of a healthier community. Every conversation about diet, every blood pressure check, and every vaccination is a step toward a future with less chronic disease and more vitality for everyone. To prevent disease, we need a good roadmap. The United States Preventive Services Task Force, or USPSTF, provides just that. They create guidelines based on strong scientific evidence. The recommendations with A or B grades are the most important ones. This means there is high certainty that the screening provides a substantial or moderate benefit. For all adults, this includes regular blood pressure checks. High blood pressure often has no symptoms, but it can lead to serious problems like heart attacks and strokes. Catching it early is simple and can be life-saving. It's a quick check that should happen at every visit. As people move through different stages of life, their screening needs change. For younger and middle-aged adults, screening for conditions like diabetes and high cholesterol becomes very important, especially if there are risk factors like obesity or a family history of heart disease. For women, cervical cancer screening, often done with a PAP test, is a key recommendation starting at age 21. These tests can find problems before they ever turn into cancer. For all adults starting at age 45, screening for colorectal cancer is crucial. This can be done with a colonoscopy or simpler stool-based tests, and it is highly effective at preventing this common cancer. Let's talk about other essential screenings. All adults should be screened for depression. Mental health is just as important as physical health, and a simple questionnaire can open the door to a conversation that could change someone's life. Screening for unhealthy alcohol and tobacco use is also a grade B recommendation for all adults. A nurse can provide counseling and resources to help people make healthier choices. For women, mammograms to screen for breast cancer are recommended starting around age 40 or 50, depending on individual risk factors. These screenings are our best tools for early detection. It is important to remember that these are just general guidelines. Your nurse or doctor will help you understand which screenings are right for you based on your personal health, family history, and lifestyle. For example, someone with a long history of smoking may need to start lung cancer screening at a certain age. The goal is not to do every test possible. The goal is to do the right tests at the right time for the right person. Following these evidence-based guidelines helps us focus our efforts where they will do the most good, preventing disease and helping everyone live a longer, healthier life. Cultural competence is a vital skill for every nurse. It means understanding that each person comes from a unique background, with their own set of beliefs, values, and traditions. These cultural factors can deeply influence how a person thinks about health, sickness, and medicine. For example, in some cultures, it is common for the entire family to be involved in making healthcare decisions for one person. In other cultures, talking directly about a serious diagnosis might be seen as disrespectful or as taking away hope. A culturally competent nurse recognizes and respects these differences instead of judging them. Why is this so important in healthcare? Because a lack of cultural understanding can create major barriers to good care. If a nurse doesn't understand a patient's perspective, trust can be broken. A patient might not follow a treatment plan if it conflicts with their cultural or religious beliefs. For instance, a diet plan that doesn't consider a patient's traditional foods is unlikely to be successful. Or a patient may prefer to use herbal remedies alongside prescribed medications. A culturally competent nurse doesn't dismiss these beliefs, but instead works to integrate them safely into the patient's care plan, building a bridge of trust. This goes beyond just language or country of origin. Culture includes many things like religion, socioeconomic status, gender identity, and sexual orientation. A nurse who is culturally competent creates a safe and welcoming environment for everyone. They understand that a patient from a low-income background may have trouble affording medication or transportation to appointments. They recognize that a transgender patient may have had negative experiences in healthcare and needs to be treated with extra sensitivity and respect. This awareness allows the nurse to provide care that is not just medically correct, but also compassionate and effective for that specific individual. Ultimately, cultural competence leads to better health outcomes for everyone. When patients feel seen, heard, and respected, they are more likely to engage in their own care. They will be more open about their symptoms, concerns, and fears. This open communication allows the nurse to make a more accurate diagnosis and create a treatment plan that the patient is willing and able to follow. It transforms the clinical encounter from a simple transaction into a true partnership. This partnership is built on a foundation of mutual respect, and it is the key to reducing health disparities and ensuring everyone has the opportunity to be as healthy as possible. Good communication is the heart of nursing. To connect with people from all backgrounds, nurses can use simple but effective strategies. The first step is to listen more than you speak. When you meet a patient, give them your full attention. Ask open-ended questions like, "Can you tell me more about what you are feeling?" instead of questions that can be answered with a simple yes or no. This invites the patient to share their story in their own words. Avoid interrupting them. This simple act of active listening shows respect and helps you gather much more information than you would by just asking a list of standard questions. Another key tip is to use plain language and avoid medical jargon. Words like hypertension or myocardial infarction can be confusing and scary for patients. Instead, use simple terms like high blood pressure or heart attack. If you must use a technical term, explain it immediately in a way that is easy to understand. For example, you could say, "We are going to do an EKG. This is a simple test that looks at the electrical activity of your heart to make sure it is beating correctly." Using analogies or simple drawings can also be incredibly helpful to make complex ideas clear and memorable. Nonverbal communication is just as important as the words you use. Be mindful of your body language. Maintain a calm and open posture. Make eye contact, but be aware that in some cultures, direct eye contact can be seen as disrespectful. The key is to be observant and adjust your approach based on the patient's cues. A warm smile can go a long way in making someone feel comfortable and safe. Pay attention to the patient's nonverbal cues as well. Are they fidgeting or avoiding eye contact? This might mean they are anxious or confused, and it's a sign to slow down and check for understanding. Finally, always check for understanding before the patient leaves. A great way to do this is with the teach-back method. After explaining something, ask the patient to explain it back to you in their own words. You could say, "We've talked about a lot today. To make sure I did a good job explaining everything, can you tell me how you are going to take this new medication?" This is not a test of the patient's knowledge. It is a test of how well you communicated. By following these simple rules, listening actively, using plain language, being mindful of body language, and confirming understanding, Nurses can build strong, trusting relationships that empower every patient to achieve better health.